All right, guys, today I wanted to shoot a video going over how you would determine if you can use a patient's existing implants. We're going to go through this case where this lady's presenting with a 2 implant overdenture and she's looking to upgrade to a fixated prosthetic. She's an older lady and she would love the idea that she doesn't have to remove her implants. And she's wondering if we can just add some implants in so that we can convert her to a fixated prosthetic. It's a really good question, a well-educated patient. And given that she's 82, I think that it might be possible to be a little bit more lenient on the implants. If someone was much younger, I think that I'm much quicker to throw away the implants that are existing because more times than not, there is something a little bit wrong with the trajectory. Maybe there's a little fenestration on the buckle, things like that. So let's jump into this case and I can show you how I really determine if I can use existing implants. So we're in blue sky plan here, and the big key here is that we virtually place implants over her existing implant positions. So if we go in here to the software and we click on these implants, you can see the outline of the implant, how I have literally placed it exactly where her other implant is. And it doesn't matter if you pick you don't need to know the type of implant this is. You just need to get a size of implant that's very similar so that you can place it in a near exact fashion. You can use this little tool right here to scroll around it. And you can see as we go around it in 360 degrees in this window, how well adapted to the existing implant position that virtual implant is. Okay, so that's what I'm doing. That allows me to measure prosthetic space. That allows me to see if I need an angled overdenture attachment. That allows me to see a lot of things. It also allows me just to look at how well the implant looks in the bone. So as we look at her 2 implants, we can see I've got a 15 millimeter abutment on here. So I know with an overdenture, if I'm getting into that 10 millimeter area, that I have probably enough room, maybe 12, depending on your preference. But certainly we've got 12, 13, probably 13 millimeters here, and this would be fine for an overdenture. If our snap-on attachment was right in this area, we're going to have 10 millimeters of acrylic. That's plenty to hide a housing and still have a really thick base without needing a metal bar or anything in our denture if we were still going to go with an overdenture. But we're going to convert her to fixed. So now we know that we have our 13 millimeters of space because we've got a 15 millimeter tube. It's up a couple millimeters. It's literally nearly ideal. And I just need to get an angled attachment. This is a 17-degree angled. The industry, uses 17 and 30-degree angled attachments as fairly general rules of thumb. And so you can look at that. The other implant that she existingly has, you can see it's fenestrated here. And I'll make a game time decision. If we're adding 3 implants here and I don't like this one for whatever reason during the surgery, a lot of times I'll just take this implant out and replace it and not even charge them anything different. Sometimes when you're in these consults, there's a little bit of showmanship to, if you get the feeling that your patient really needs you to be able to work with those implants to just feel more comfortable accepting treatment. I've never had a problem where later on I said, hey, I got in there, I flapped this off. That implant had a lot of bone exposed, more than I even thought on the software. And so I just kind of gave you a free implant. Is that okay? And I mean, more times than not. And when I say more times than not, I mean, so far, I've never had a patient have an issue with that. And for me, it's not really a lot more work. If it makes the case more predictable, that's fine. But what we're proving here is that even though it's fenestrated, if it's integrated really well, and a lot of times when they're placed all the way down here into the cortical bone, they can be very difficult to get out. So we may want to decide to leave it as well. And if that's the case, we know that now putting an angled abutment on this one as well does bring the snap-on attachment into the denture base. For us, we're going to be doing fixed. So we can look at the difference in angulation, and I think we're still okay here. If we have an angled MUA here, then we're going to have our screw hole coming directly through the cingulum of the tooth. And you can see that the same on this other one as well. Then we're just virtually placing 3 more implants into the jawbone. And we've got our entire prosthetic and surgical plan figured out here. We know that this is where the new teeth go that we're setting. And we know that we have plenty of prosthetic space based on those 15 millimeter tube heights. We really only need 13, so we've got ample space in this particular case. So that's how I decide if I can work with existing implants. We start with the final tooth position, then we virtually place an implant superimposed directly over the existing implants, and then we just use the abutment tool in Blue Sky to add in, any angles or anything like that. And if you're wondering how we do that, we just right click and we hit replace abutment. And then you go in here and you can change your degrees. You can change the height of the tube. You do have to select custom abutment. It will default to no abutment. Or if you select abutment, this is actually, you can pick the actual angled MUAs and whatnot from the different companies and different manufacturers. Some people like to do that. I don't like to go and have to find all those because a lot of times that can be kind of confusing on the way they name them. I like to just go in and place my custom angles and then do my measuring. That works well for me. But if you want it to be exact, the software has that feature as well. So Blue Sky Plan is a free download. It's a pretty cool way to bring your prosthetic plans into a surgical realm and create surgical guides and really nail your surgeries. So I hope this video helps. This is really how I figure out if I can use existing implants. As a little side note, if you don't have this or didn't take time to do this, I would default on the side of saying that you cannot use existing implants to convert from, say, like a custom abutment or crown to a denture. So many times that I've told patients that I can do that without doing this procedure, and that has bitten me. And when I was early in my implant career, that you're trying to make things easy for patients. Yeah, we can use that implant. That's great. And then what you end up with is an area in the prosthetic that is usually a weak point, and the prosthetic breaks there a lot if you're converting to fixed, because that implant was not placed with the idea of having a fixed prosthetic over it. Many times you just have to remove them. In this case, for an older lady, I think this proves that I can likely work with both of these. This one's a little bit in question, and we'll just preface her for that, at her medical review appointment, letting her know that, that one is a little bit in question, but we'll stay with our original treatment plan that we're going to keep them both and just have these angled attachments on hand. All right, guys. Thanks. I hope that helps. Thanks for watching.